Hello, everybody. I'm Peter Bruck. I'm the chairman of World Summit Awards, and I'm just absolutely delighted to welcome you back for this next session, the panel on healthcare and especially the healthcare gap. Every one of us experiences at the moment in his or her everyday life that healthcare is not an abstract issue when you are ill, but that healthcare is something in the times of the pandemic, which is absolutely key to the functioning of society, our cultural exchanges, our spiritual lives, our economic activities. And therefore, this is a most timely event now, this panel within the World Summit Award Global Congress. We have a number of really fantastic speakers, and we are connected all around the world, from San Francisco all the way to Botswana, from Slovenia all the way to Lebanon and to Spain, especially also to all those people who are part of the community of winners, people from Brazil, people from Finland, people from China, people from Germany, and people from Belgium. I welcome these teams especially. Let's start with a short personal introduction of each and everyone on the panel so that you can hear them in their own words, and that we will then follow up on the issues and topics generated. What is the topic? The topic is that innovation with using digital solutions needs to address the healthcare issues, the wellness issues, the pandemic issues in each and every one of our own countries. And here we are looking for solutions which assist single people, but which assist also entire communities. And let's start with Nadine. Nadine, you are the co-founder of Proximie, which is a winner in WSA in 2018. I understand that you are calling in from London. Please introduce yourself, introduce also your winning project and product, and also the journey you have taken since winning WSA and how you look at the healthcare gap today. Please.
Thank you very much, and it's a real honor to be here with such a global audience and a global panel as well. I'll probably share some slides to walk you through my journey, and I think it's really timely as you talked about sharing the importance of healthcare and the benefit, and within this pandemic and everything that's happened, how crystallized that has become on the global scale. So for those who don't know me, my name is Dr. Nadine Hachach-Haram. I'm originally Lebanese. I'm calling out of London today. My background is surgery. I trained as a reconstructive plastic surgeon many years ago, really to focus on delivering and restoring form and function to patients. I was very passionate about making sure people could have the best care possible. And after 10 years of working within my own health system, but also around the world through global health initiatives and innovation initiatives, what really frustrated me on the front line was that we have a high amount of variation. Today, patients walking into one hospital are still having a very different experience to patients in another. There's variation in quality, variation in access, and variation in care. And probably the reason of this is because of the genesis of surgery. When we look historically at how surgery was born, it was predicated on the idea that we needed to communicate, collaborate, and be co-present in order to scale expertise and drive new innovations and techniques. If you look to the picture on the right, we haven't adapted our models to the fourth technological revolution. And so what happens is that you end up creating this idea of more people in an operating room, hoping that this will scale expertise. I'm sure you'd agree with me that this is not conducive to scale or quality. And so as a result, we have a high amount of variation. Patients, for example, even in the UK, can have 14 times more chance of having variation colorectal surgery and in others. Today, 5 billion people in the world lack access to safe surgery. And today, even in the United States, you're 3 times more likely to die from surgery in the lower performing hospitals than the higher performing hospitals. And so this idea of quite simply where you live determines if you live or how you live is something that, I feel is no longer acceptable, and we need to drive forward. And so I started to think of, as a surgeon many years ago, how do we change the paradigm? How do we change the operating room? And it became clear to me that we needed to really globalize and digitize the operating room. I still remember sitting in an OR years ago, 2014, 2015, on a footstool and looking around the operating room and thinking, why is everything so analog and so manual in this world where everything is connected? How are we still doing surgery this way? And so I created an idea around connecting and creating a data web and a connection web across all operating rooms around the world, enhancing communication, immersive engagement, so we can actually virtually reach in and share best practice, and to deliver this in a way that's democratized, so on ultra low latency, and by using existing hardware. Because the more that you can reduce obstacles and friction, the more scalable and adopted this is. And as I started to think through this, I started to think about how do we provide support? How do we expand our capacity as surgeons? There's not enough surgeons to deliver care for patients. More broadly, there's not enough surgical teams to deliver what clinical patients need. And how do we enhance preceptorship and proctorship, coaching and enhancing skill acquisition? And so that really was the birth of Proximie back in 2016. The idea that by surgeons, for surgeons, we can create a platform that can enable you simply by using a phone or a tablet or a computer to virtually scrub into any operating room, to share best practice, collaborate, and ultimately deliver the best care to patients possible. And we launched this in mid-2019. And since then, we are now in close to 300 hospitals in over 40 countries, delivering and democratizing and enhancing the delivery of care to patients all around the world. And we have published a multitude of papers and articles that supports this and shows that this is a way forward. We've done it across a broad spectrum of socioeconomic diversity, of clinical diversity and specialties. And we've been able to do this connecting hospitals and doctors all around the world, from London to the US, to Benin, to India, to Japan, to Singapore, Australia, Gaza, all these countries coming together to scale expertise. And so I'd like to share a video that perhaps also resonates with me as it comes from my home country, Lebanon, and the challenges that we've faced recently.
As an entrepreneur and surgeon based in the UK and part of the Lebanese diaspora, I was devastated by the blast on August 4th. As I saw the footage and spoke to friends and family there, it brought back memories from my childhood of a war-torn Lebanon and that immediate action needed to secure medical assistance. This resonated with what ultimately drove me to become a plastic surgeon in the first place. The long-term consequences in reconstruction needed to help patients restore better form and function and give them a better quality of life. Giving back to Lebanon through Proximie was important because as a very multinational company, we all pull together. And Lebanon has always been a core part of our Proximie family. There was a particular case at the American University of Beirut Medical Center whereby a patient had lost his thumb during the blast,
follow my markings,
which immensely reduced his hand's function. A toe-to-hand transfer was a solution, but not a common procedure, and one which is a great learning opportunity for trainee surgeons from all over the world.
Can you see my hand now?
This is why we decided to support the case and connect clinicians through the platform using nothing more than a phone, tablet, or computer. Dr. Zajc led the operation while interacting with trainees from all over the world, explaining the different steps of the operation and what the indications were.
Countertraction should be here.
The patient got the operation he needed, but ultimately so many other surgeons were able to immerse themselves using the augmented reality tools to interact and benefit from the learnings and familiarize themselves with the techniques to support this in similar future cases. In fact, Proximie has always been about scaling expertise to operating rooms around the world and virtually supporting surgeons to deliver great care. It has been a unique year for us as COVID accelerated the usage of our platform, and we were there to support and create impact. We made it possible for surgeons in operating rooms to dial in colleagues for the extra layer of coaching and mentoring, whilst keeping them safe and less exposed to the virus. In 2020, our business accelerated. Our team has doubled to over 50 members. Our platform is now in over 200 hospitals globally, 35 countries, and has performed over 6,000 cases just this year. And we're really filling a need that is more and more urgent than ever before. We're also proud to be part of the Endeavor Network. Every patient deserves the best care the first time, every time.
you very much.
Thank you very much, Nadine. This is just really inspiring, and you have carved out a very particular niche, which is so important, is how to scale the expertise for operating rooms around the world, recognizing that plastic surgery, reconstructive surgery, is especially important under conditions of war, of emergencies, and situations like the one which you have described in Beirut after the blast in the harbor. I think that is something which links you very well to other parts of the world, especially where the expertise in surgery is not given, and we will come back to your topic. The next person I welcome here is Alejandro. Alejandro, you are part of Miroculus, and you are now calling in not from Chile, but from the US. And I say good morning, good night to San Francisco. Alejandro, please introduce yourself.
Good morning, Peter. Good morning, everyone. I'm happy to thank you very much for inviting me to participate in the panel. I'm happy as well to find other endeavor entrepreneurs. Our journey has been really a fantastic journey, and since the last time we met in Singapore, things have changed and evolved into what we are today. We started doing really looking at microRNAs, which is a small molecule that can be found in circulation, and we were using that molecule to find or to look for early signs of cancer. And from the very beginning, since we, the founders, met, we wanted to simplify how science is being done and delivered so that more people could have access to the state-of-the-art testing in that particular moment, very focused to cancer. And while doing that, we realized that the current technologies were not there yet. So what happened was that if you wanted to get the best testing, if you wanted to get the best access to healthcare, if you wanted to get the best treatment, that was only possible in few labs, in few medical centers around the world. Now, how do we scale that, and how do we do so that more people can have access to this type of testing? We needed to redefine the way testing was being done. And since then, we started developing a new technology that will help us fully automate and simplify the most complex biological workflows for genomic testing. And while doing that, we came up with a new technology. It's an instrument that we have, where we have today over 40 patent applications, that allows scientists, clinicians, hospitals, and researchers all over the world to basically download the latest tests available and run them in a fully automated fashion. So now you don't need highly skilled technicians to run these tests. You don't need very well-funded labs to run these tests, but by delivering our technology, now you could have a lot more people having access to the latest genomic tests. And as a first application, we're going after genomic testing or next generation sequencing, which allows us to fully read the DNA of a patient's tumor or of a virus, for example, COVID, that's another example, or even for early cancer detection, for understanding how to treat it, or for understanding a wide broad of diseases. We believe DNA sequencing is going to play a crucial role in what's coming next. As one of the examples we're very happy to work on, we do work with the Broad Institute in Boston, that's the genomic center from Harvard and MIT. We do work with other hospitals as well, where we're looking at how we can sequence the entire genome of, let's say, a baby when it's coming to the urgency care room where we don't really know what the diagnosis is. By reading the genome of that baby, we can understand whether that's a rare disease, if there's any intervention that needs to be done or not. And we believe where this is going is that in the future, every baby that's born will have their whole genome sequenced or their DNA read. And with that, we can better prepare for what comes next. Now, we want to have that delivered at a global scale. And for that, we need technologies that are simple to use, affordable, and that can allow us to stay connected with the rest of the community. And together with the technology, together with the instrument, we have created a portal where users, where researchers can upload new tests, can upload the latest state of the art in the research, so that now if a workflow or experiment or protocol has been developed in Stanford one day, that same protocol can be available in Chile that same very day for somebody else or another lab to download it and run it. So we are decentralizing the evolution of science to accomplish our mission, which is to advance science and improve lives faster together. We, since we met, we closed a new round of funding just a few weeks ago. We announced the completion of our Series B of $45 million, having two very large VC funds from the US. So we are now fully based out of San Francisco with a team over 40 people. And it's a global team, which means that we have the majority of our operations based in San Francisco, but also we have software engineers based out of Latin America. We have people based out of Korea and other places around the world. So very, very happy to be here. Thanks again for the invitation. Looking forward to participating in this panel.
That sounds like a really interesting journey which you have taken over the last 2 years since being winning in the World Summit Awards. I congratulate you. What you're addressing is obviously the testing gap which we have around the world and which people feel very much the pain of in terms of the restrictions which we have under the pandemic conditions. So the sequencing is a real issue. I mean, in countries even like Austria, it takes 6 days, sometimes only 3 days, but it is a real issue. And to open up that situation and to get through that kind of bottleneck is a really important thing. Like Nadine was addressing, she was looking at the gap in terms of skills in the operating room, in surgery, plastic surgery, reconstructive surgery. You're looking at a different kind of gap. I think that makes it very interesting to see how we can improve the healthcare. Now let's go to Slovenia and go to Tjasa. I hope that you can hear me well. Are you ready to present yourself and also to possibly make it a little bit shorter than the other ones?
Absolutely. Hello, everyone, and welcome from Ljubljana, Slovenia. My name is Tjasa Zajc. I'm a former full-time healthcare journalist, currently working as a community developer at a healthcare IT company called Better that is offering healthcare institutions and healthcare systems a platform that is vendor neutral, which means that the data is separate from applications, which in essence enables the patient data to be durable for the time of the patient's life, and the data is not locked in by vendors. But the reason I'm actually here is because even while I'm not working as a journalist full-time anymore, I still run a podcast called Faces of Digital Health, which explores how different healthcare systems around the world adopt technologies. So my interest is to see and to share with the audience how countries outside of the US are considering technologies for the healthcare improvement, how the culture impacts the way technologies are used and which technologies are used for each problem. So that's kind of in short. I'm sure there's going to be plenty of more opportunities to talk about what I found out so far in over 150 episodes so far.
And that makes us very curious. These episodes of your podcasts are in English, French, or Slovenian?
They're in English.
In English, okay. And I find it interesting that you are saying that the culture affects the adoption of healthcare technologies. Can you expand this a little bit and use the term of a gap, which I mean you can see, and where is the stumbling block, where is the bottleneck, and how could we overcome it?
So when we talk about healthcare, there's always this idea that, you know, technologies can be used globally, and that's true. But in essence, healthcare is always local. And the way the local environment is set up impacts the way technologies are going to be adopted. More specifically, you know, today when we talk about mobile technologies and mobile applications, what we in the West usually think about is smartphone apps. But in fact, in Africa, a lot of healthcare apps that are available to people and are in dire need of being available because the infrastructure is really poor there. Those apps are still based for so-called dumb or regular phones and are based on the USSD protocol. So if you remember in the old days, you know, when you wanted to check your mobile balance, you would type in a *123* or some sort of a code to get a response. So there's a lot of applications like that are being developed there. Or when I say that the culture impacts healthcare in Japan, Japan is one of the countries with a very high number of MRI scans, which makes it very easy to get an MRI scan. However, the issue there is that more often than not, these scans are done without a radiologist. So there's companies that are present there that are looking at ways that would give clinicians AI tools and help support them with their decision making in trying to read these scans. And you know, and then there's all sorts of issues connected to that. So that's just kind of two examples that I hope make it clear what I mean about culture and technology. Perhaps one thing that I feel that is very interesting in a sense when we say that culture impacts technology adoption or perception. I recently spoke with an entrepreneur from Tanzania who is basically providing healthcare information to the people, and in Africa, because of the culture, problems are different than perhaps in Europe, you know. So in Europe or in the West or in the US, when we talk about privacy issues, what we talk about is how companies are using patient data or just consumer data, who can see the data, which company is a third-party provider that's also accessing our data without us actually realizing that. When in fact, you know, in Africa, the privacy issues are completely different. There, for example, women would worry that if they search for something, are their families or their partners going to see what they searched for? Because when the information is lacking, what people base their opinions on are traditions and traditional knowledge that comes from the culture. And that can also be based on misconceptions, you know, for example, that, you know, when a woman has her period, that her body is being cleansed from evil spirits and things like that. So it's having actual medical information about what's happening with a woman's body during that time can be really important for a woman. And that's something that we think about very differently in the West, where the education and the environment is completely different.
Thank you very much. This is very interesting because it addresses also one of the most important themes of World Summit Awards, which is how to hack the gender gap. And the withdrawal, the stigmatization, which comes with having information on, for instance, women's issues, is something which is a real key issue, not just in Tanzania, but we know it from many different people, from Pakistan all the way to some parts of Latin America. What you addressed in Tanzania, we can possibly elaborate with Cristina. Cristina, Birsan, she's joining us from Botswana. And Cristina, just tell us what you're doing in Botswana and how you view the healthcare gap from there. Cristina, please.
Thank you, Peter. Hello, everyone from Gaborone, Botswana. I'm fairly new to this space, to this country, and to this role I'm now having in WHO, the World Health Organization. I just moved here from the far north to the far south, from Germany to Botswana about 2 months ago, 2.5. And I am the External Relations Officer in the country office of the WHO. In addition to my role, my day-to-day work, I also coordinate the COVID-19 efforts in the country within the UN system, meaning that I'm trying to act as a liaison between the global UN and the agencies present in Botswana in regards to the access to vaccination, COVID-19 vaccination. And what I want to share today with you in this workshop, it's COVID-19 related as well, because, and maybe quickly just sharing my screen with you. I only have 2 slides if they, okay, if they're loading. Bear with me, I'm from Botswana and the bandwidth sometimes is problematic.
It works perfectly.
Wonderful. Can you see my screen then, please?
Yes, shareverified.com.
Indeed. All right, I wanted to say that as the COVID-19 pandemic spreads, full screen immediately, an F5 should do, right? If it wants. Sorry. All right, I better continue then, because it takes a while for this function. There is no much, I promise you, it is not a small font either. My point is that COVID-19, as the COVID-19 pandemic spreads, another virus is infecting our lives, and this is the misinformation. For me, my background is communications. Good communication in this pandemic can save lives. Verified is a UN initiative, a project that aims to flood the digital space with facts amid COVID-19 crisis. It organizes a network of millions and millions of volunteers, online volunteers, who are curating online information around any information around COVID-19. And with verified, basically there are 3 teams that they want to work on. It's about science, solidarity, and solutions. Basically, with verified, we can all fight lies and conspiracies with science and life-saving health advice. We can fight hate speech with solidarity. We can fight despair with hope. And solutions for how to recover better. And only together, but only together, we can end this pandemic and recover after this pandemic, is what I wanted to share with you. And I will stop here for now, and thank you again for the opportunity.
Thank you very much, Cristina. Now that you're working within the United Nations system, do you see that there's considerable differences in terms of fake news and conspiracy theories between different kind of regions in the world? When you look at it from Botswana, what are the main, let's say, stumbling blocks here in order for people to get an accurate information, which does not incite fear, but actually trust in terms of the scientific revolution, which is taking place with these completely novel vaccines.
Thank you, Peter. Indeed, as I said, I'm new to this space, but I could sense immediately huge differences between the area I'm coming from Europe, from Germany, more exactly, and what's going on here. Indeed, the culture background has an important role in this situation. What I, for instance, notice here, it's something that Tjasa said also earlier. People fear about saying clearly what's wrong, and around this, it's a veil of secrecy. For instance, stigma as well, and those are things I did not notice in Germany or in other countries in Europe. And such platforms, such initiatives could also help, I believe, these gender gaps on one hand, as Tjasa said earlier, and also culture differences between different countries.
Thank you very much. That's great. Thank you also for sharing this first. We are coming in at different levels. Now, one of the persons who has been part of our network for many, many years is Jordi Pons. He joins us from Spain. Jordi, your view on gender gap and also on the healthcare gap specifically. Tell us a little bit about what you do currently and how you have evolved over the last 2-3 years. Jordi, please.
Thank you very much. Thank you very much, all. It's been a pleasure to listen to you all. And congrats, Peter and Nora, for always keeping the level so high after all these years. And congratulations for having all these great people fighting for the global health problems together. It's been very exciting. I launched for the first time in the WSA in Abu Dhabi 2015 or 2014, I think. And since then, it's been a pleasure to see how all the problems that we were trying to solve at that moment there. We started many years ago. Let me share my screen. One moment. Can I share my screen? Yeah.
Yes, you can.
Good. So let me see about that. So basically, as I was explaining many years ago, right now we are launching a new company called UDA Health, UDA, which is basically Universal Health Digital Access. This has been a long evolution after, now we are 18 people, Peter and Noran, we were less and less, and our evolution came from Universal Doctor, which was our initial company that developed an initial tool, a translation tool, to improve communication between patients and doctors that didn't share the same language. And we kept moving. We were lucky to work with World Health Organization in many projects. Basically, in more than 30 different international projects with WHO, IOM, London School of Tropical Medicine. And we've been working in these decision support tools, chatbots, data collection, all these type of tools in different continents, always aiming to try to tackle global health topics. And it's been amazing the last 10 years. Our initial tool, Universal Doctor, was embedded in more than 100 countries, hospitals, and so on. And that helped us to have that network of solutions. And slowly we have been changing, developing what we call other Legos about global health, mental health with WHO, or ICOP, intrinsic capacity for older people, also with WHO, many different tools. And now all these Legos, we are now converging them. and having that global solution, which is called UDA Health, Universal Health Digital Access, in where basically we have very quickly these two big branches, universal health studies and universal health monitoring. And this is a global solution where we have a disposal of all the countries that are non-OCDE countries, these tools for free, pro bono, as it has to be, to monitor the tools, to monitor saturation, heart frequency, all the things that we have already implemented in the OCDE countries. And also we have a platform, Universal Health Studies, which we'll explain very quickly, which during this year we have improved a lot thanks to our solidarity project called Epidemics during the pandemic. And basically we are very happy because we've been evolving continuously. And this last year, basically, let me explain you what we have done for the pandemic very quickly. We were 1 year ago precisely here in between Geneva and Barcelona, wanted to help people, and it goes also in relation with the last conversation, also with fake news. It was at the beginning that we wanted to have a website where to gather all the protocols in that moment, and it was very successful. We launched it very quickly, 8th of March last year. In 4 days, we had more than 1.5 million views, and that was a very simple info website with all the protocols and different guidelines from more than 27 hospitals and international organizations, and also specialty associations. And that evolved also into a TV channel during the year with more than 120 interviews and so on. But finally, we ended, as it has to be, with a solution called Epidemic Studies that has reinforced a lot researchers to do what? To disseminate their studies. Not all researchers have good funding for their studies, so we have made the editing of these studies in a very nice way, plus the description of the study, the objectives of the study, and very importantly, we have created crowdfunding campaigns for the study. For example, this study has already have 10,000 euros. This is a Esperanza study, which is a long-term COVID study, and that has helped a lot to boost the community of researchers, and it's been amazing. And as you saw before, for us, this is a solidarity movement, but very, very used to it, as Peter and Nora knows. And it's always a way of working together with solidarity and also in a freemium model for the rest of the projects. No? So basically, that has helped a lot of researchers during that year. And at the same time, it has helped us. To improve our universal health studies platform, which will be available for everybody around the world. A platform to disseminate your study, to ask for funding of your study, to have like an open data platform, collection data tool, which is very important. There are currently other studies, other data collection tools like RedCap for researchers around the world, but they don't have this open data component that we have been fighting. And it's very easy. We do things for OCDE countries, people pay, but non-OCDE countries always have all these tools for free. And this is a way to where we feel very comfortable. And thank you very much, Peter and Nora. It's been a pleasure always. Thank you.
Thank you. It's wonderful to hear you and to see how entrepreneurial you are. And you are one of those people who basically epitomizes and embodies very much the social entrepreneurship which WSA is all about. Now, the topic of our Global Congress is Connect for Impact. And therefore, I want to use this panel in a very different way than normal panels are. Because I want to ask Nadine, for instance, or Alejandro, what did you learn What new ideas did you have now that you have listened to Cristina and to Jordi and so on? And let's just work around how we can on this panel learn from each other and what it actually concretely means. Because when I look at, for instance, Tjasa, I think maybe you want to do a podcast on Jordi, or if I look at Nadine and your notion of a data web, enabled, community of surgeons around the world. These are just some ideas. Nadine, why don't you start off? What did you learn now that you have heard 4 or 5 other people speak about the healthcare gap? Please.
I think one of the key things is it's not really about technology. We can all come with a different solution that's solving a problem. I think ultimately it's about raising awareness, getting buy-in and adoption, and building trust. All these solutions that we're describing really goes back to the bit about misinformation, about raising awareness. So when even we launched Proximie, yes, half of it was about the software stack and the impact that we could make, but more so was about how do we continue to build trust with healthcare workers? How do we increase adoption and accelerate the belief in this new way of doing things? If you walk into a hospital and just say, oh, I've got this data architecture in the cloud, that's not going to resonate or land with people. So we need to make sure that the messaging and the communication around what we do is clear, and that we unveil this mystery of what is in healthcare or the operating room. So we've done some things like LinkedIn Lives, we've done podcasts, we've done others, which clearly other members on the panel have worked to, and that would be the learning. Again, I think if we look across all of us, there's a common thread, and it's about trying to make impact, but trying to raise awareness and build good communications and trust in what we're doing.
Thank you very much, Nadine. I think others might elaborate on this right away. But Alejandro, from your point of view, what have you learned now from this panel so far and from the others who have spoken? Please, Alejandro.
Yes, thank you. I think one core topic that we have been discussing about is the knowledge sharing. So I think answers are already there, and what's somehow blocking us to make more progress faster is the lack of access to that knowledge. And when we see other projects where it's all about how we can share this knowledge with the community, I think that's where we can scale science faster. And a key component of that is how we share it in a channel that is trustworthy and science-based, results oriented. So the one thing that we try very actively to do as well in Miroculus is every time there's something new we develop, we want to share it with the community, and we do that through posters, through publications, through collaborations with partners, the same way other projects here do it through other channels. But at the end of the day I think there's a lot of really good science being developed already. There's a lot of important methods available already, and now a key task that we all have is how do we make this knowledge available to everyone, and how we decentralize this knowledge in a way that everyone can have access to it.
Thank you very much, Alejandro. I think I'll come back to this in a second, but first I want to ask Tjasa, what is your view on what you have learned, what is new for you from what people said? Just share this with us, please. We can't hear you.
Yeah, I'm unmuted now. So yeah, to me, all the speakers were quite fascinating in a sense of what kind of problems they're trying to tackle, and I would be very curious to hear more from Nadine, and how did you tackle the cultural challenges working in so many countries? How do surgeons think differently about the same procedures? Because we know that different hospitals have different approaches, so clinical guidelines are already sometimes a challenge to create. create because of different clinical practices. And once you scale that on a global level, I imagine that the challenges are even harder. I really like what Cristina mentioned about the misinformation, which I would say is a really huge pain and plague these days. And it, you know, as a former journalist and a journalist by training and by heart, it really pains me to see the state the media has found themselves in, the fact that even reputable media is disrespected these days, despite the fact that the level and the time invested in fact-checking there is incomprehensible and incomparable to anything that just regular bloggers do. But in the era of internet, everybody has the right to express their opinions. So the misinformation part is a huge challenge. When we see that constantly emerging and being accelerated. So, now in Europe, when the vaccination with the AstraZeneca vaccine stopped for a while until the European Medical Agency didn't clear the vaccine, obviously that was a further boost to new misinformation and conspiracy theories, which are basically taking us away from achieving public health and just normalcy that we all crave for so much.
Thank you very much. The focus of the World Summit Awards is very much content-driven applications. So these are applications which, what Nadine was saying, they build on trust, they deliver trust. What Alejandro was saying is they actually are knowledge-based, and then they are knowledge addressing, and definitely also misinformation countering. Cristina, give us a little bit more on Share Verified, because from what you showed us very briefly, that seems to be a platform which, at least deals with one part of the puzzle.
Indeed, thank you, Peter. So it's a platform that I would very much like to see replicated at different levels to start with. For instance, if this is about misinformation, I would love to see some, and I'm sure it exists, but maybe raising awareness more about it, like what kind of emotional support we all can get, especially in these times. Because you see, this COVID-19 is not just the century largest public health emergency, but also a communication crisis. And with this, people can empower every day to spread trusted information with friends, with families, with social networks. But also what I see every day around me, I have colleagues with COVID, and they stay in isolation for weeks, or with their families, with children, or others. We need to know that it's somewhere there and support us. And these kind of, I guess, tools, I see a gap there. I'm sure it's more for us to do on how you can feel better from home. We spend so much time at home, and that would be one gap I would like to highlight here, and maybe solutions will come soon, and to connect us with an impact.
What you're doing with Share Verified is very much addressing this issue of how to address fake news. But then on the other side, a lot of what trust and knowledge sharing concerns has to do with access to data. And Nadine, you were talking about this regarding what you have created as a data web. But I want to ask Jordi, you are just so entrepreneurial that there's a lot of things happening, but where do you see the best practice of how to use share data and open data, especially because that what we need to do is basically, from the research side as well as from the healthcare professional side is to find a secure and sovereign way of using data, and how to build actually the data infrastructure and the data connectiveness in order for our technologies to work with. Jordi, do you have a thought on that?
Yes, thank you very much, Peter. Indeed, absolutely, because we have seen how shared data can accelerate the research, for example, during the pandemic. No, a lot of data was shared between even competitors. No, because at that point, what was important was to find some potential side effects or some potential stoppers that would block the development of some of the vaccines. No? What the pandemic has done is exaggerating the threat, but the problem is how many medical family doctors, nurses around the world that could make research have not capacity to collect data first, and secondly, share that data in open data platforms in a way that they could be invited to participate in different new clinical studies, for example. It's not impossible to foresee a very near future where you are using a monitoring system, and then the system tells you this with anonymized data of patients, this data of these patients, this data has a pattern of data that has been used. A similar pattern has been used by a family doctor in Milano, in Bergamo, to do this type of a study. Because what we have to do is to democratize the capacity of doing studies. To do studies, we have to desacralize sometimes the hiddenness, the data is hidden, just to make it super open, super clear, and with a balance of course, as Tjasa was saying, that the data is not embedded in the platforms itself, but the data is, this embedded from there, no? And yeah, the potential is enormous, not only for super scientific challenges, which it is, but for the daily basic cases of normal patients, usual patients, that finally, for the first time, we can have a prognosis, we can have a prevention, no, strategy, to a prediction strategy to start with, because at the end, the system is getting older, more expensive, and if we don't use this pattern data as a mechanism to propose specific guidelines for specific people for preventive mechanisms, the system will not survive.
Thank you very much, Jordi. That's a very interesting issue. Nadine, you seem to be very much in line with working with data and also the software side. How do you respond to what Jordi has said now regarding democratizing studies? And also Alejandro, I mean, when you are doing, scaling up the testing capacity, how are you dealing with the data side of it? First Nadine, please, and then Alejandro.
I think the democratization bit is absolutely key. There is a heterogeneity of health systems all around the world. And so we need to start thinking about how do we deliver solutions that everyone can have access to. If I'm delivering a solution that's only beneficial to, the UK or Europe or the US, you're really obstructing access to so many other parts of the world. And so to give you an example of how you make purposeful decisions around the design, it goes back to that democratization. So, when Proximie was being created, there was a lot of work around augmented reality, headsets. Many companies came out with pretty expensive wearables. What was clear to me at the time was that it didn't really matter if you were in Europe or in the global south, everyone had a mobile device. So how do we find a way to ensure democratization? So we designed purposefully the software to be accessible by anyone and everyone. At that point, that's when you can really globalize these solutions and not make it obstructive based on socioeconomic status or country status or GDP, etc. So that I think is really critical. Speaking as a frontline clinician, someone who's worked both in the West and in the East on war zones and in wealthy, affluent healthcare systems, that is the most critical bit. That velocity and agility of scale can only happen when you design things in a way that's democratized and scalable. And the other bit to say is that the thing that used to annoy me the most is that there is this perception that actually the West is more established and therefore can adopt solutions and technologies at a much bigger pace and a faster pace than perhaps the global South. But I think we can all look back to the story of M-Pesa and many others that shows that we can have reverse innovation. We can actually demonstrate leapfrogging and scale across these geographies to teach us perhaps in the West how we can do things differently. So I'm a big believer in that democratization and velocity, because you want to make sure that people can adopt this and that there's evidence behind it as well. The more volume, the more engagement, the more diversity in data sets, the more that evidence and that knowledge, that data, machine learning becomes meaningful.
That's brilliant. Thank you very much for sharing this, Nadine. Alejandro, what do you see and how do you view this from your point of view, especially since you are now having 45 million euros from an investor, and you are now possibly even, put into a straitjacket regarding democratization of data and so on. Please.
Yes, I think one I would echo what Nadine was saying on how to make technology simple. I think sometimes we forget while we're developing technologies that at the end of the day, if we really want this to be scalable and used by a broader population, we need to make it simple. And we need to, while thinking of democratization, we have always thought of how do we make a technology that would work in any research or clinical setting. And the way we thought of it is we have to lower the barriers for this technology to be used. And that goes in all fronts. That goes on the price you put on the technology, that goes on the skill set needed to use that technology, and that goes on how does this technology connects or fits into any setting where it can be used. So with those three things in mind, we started developing what we have now, or what we call now the Miro Canvas, which is our first solution to fully automate the most complex biological workflows, including everything that needs to happen before sequencing a sample or before sequencing any type of specimen that you're interested in. And the data sharing, I think it's a key component in which I think here is where the community has an important role to play. At the end of the day, we just set the platform for the community to share that data. And when that data is coming from reputed agents or it has solid science evidence behind, is that it's when it becomes more widely adopted. So at the end of the day, we're not the ones creating all the content. I think that's where the power of the community comes in. We allow the stage, or we set the stage for the most influential players, and maybe those that are not that influential yet, but those that are doing good science have now the stage to push their science forward or to push their experience forward so that more people can use it. But at the end of the day, I think our role is not to create all that content, but more to set up the stage for others that are doing science can share it with the rest of the community.
Thank you very much, Alejandro. You are speaking very much from a point of somebody who is really involved in this and who is trying to be, on one hand, an inventor, entrepreneur, but also to see how with your new invention or your new product of the Miro Canvas, one can have a scalable solution. Cristina, when you see from your experience, given that you have been in Botswana only a short time, but from the ecosystem which you see there, how would this work in a country like the one in which you are staying now? And what can the UN system actually, from your point of view, carry and deliver in this regard?
Thank you, Peter. It's a very complex situation here. Things I did not anticipate. I tried to do my homework before leaving Europe. but the reality it's revealing day by day. It's a complex environment, and you have to observe and not to forget here as a UN that you here to support, to facilitate, to basically link between different actors and to support a health system. And what is maybe interesting to mention, just for you to get a bit of an idea, please have in mind when we're talking about health in this country, we're talking about the country, maybe the most affected country at the global level in terms of AIDS. And this set it's a history here that you can never get, you cannot ignore in any other action in the health system you will take. And maybe I can relate this, for instance, in my work. This is one of my focus areas now, for instance, how to fight against stigma and discrimination, and to come out clearly to say, yes, I'm COVID positive and I'm not coming to work, but I'm ready to work from home, and I don't know, things like that, because it's about sharing responsibility afterwards and sharing, caring about the others around you, and not coming to the office if you're sneezing and show some symptoms. And I try to link the two. How was about stigma and discrimination during the AIDS time, and how we can maybe learn the lessons from that and do better this time. But again, for the UN system, is not necessarily the easiest environment in terms of healthcare, especially in the remote areas. In the capital city, in Gaborone, they have amazing hospitals, but they lack maybe medical staff, trained medical staff. But if we're talking about remote areas, this is where we register every day lots of deaths because people are not taken care of, let's say, in the hospitals. So I'm learning, and I'm ready to make a summary, maybe with a next intervention when I'm invited to tell you more in a year time about what is the situation here. Nevertheless, it's an enriching experience. I'm learning every day. And what I can also tell is that they learned some of their lessons. And I can tell that the response they got, it's maybe something we can learn from as Europeans, if I can include myself in that category. So they were ready, maybe more than Germany. I can tell. Thank you.
Peter, I think you're muted.
Thank you very much, Cristina. We have another 8-9 minutes to go. That's really great that you shared with us this notion, which from possible San Francisco or from London or from Slovenia or from other places, one doesn't even think about anymore so much what is the social effect of stigmatization and discrimination on people being affected by an illness, be it a pandemic, be it AIDS, be it some other ones. So that is, and you can't collect data when people are on restricting and avoiding and also possibly lying on what it is. Coming to the end of this panel, and before I shift you all and we all go into the lounge to meet some of the over 80 participants in our panel now, let me just ask, Connect for Impact. So that means, what is the one concrete thing you are taking away now from this panel for what you want to do when you think about the learnings of having listened to each other? So we'll start now with Jordi, because Jordi is so exuberant in getting everything going and entrepreneurial. Jordi, what is the one thing you will do after this panel is closed and to act on what we have discussed? Please go ahead.
No, thank you, Peter, and congratulations again. As always, it's redundant, but connect means connect, no? To have impact, you need to, you cannot do all. for example, if Alejandro do a good test, no, a good testing mechanism, and Hachach can really deliver, no, surgery to many other people around the world, and Tjasa works in a company that really democratized through the and Birsan in the WHO office. So everybody has a role, and sometimes we are very, very overwhelmed with the daily activities, or to raise funds, or to look for clients, or to develop the tool, or we forget about these potential partnerships, global partnerships, that are super important. And as maybe for investors, that is not an important thing at the beginning. For real impact, you need to have all these things from the beginning well thought. As okay, if I have a platform that have to do with the studies, or maybe I can connect with Hachach because she can be interested in that many surgeons use the platform to have studies there. And the opposite, if I know that in a patient, and sometimes this is very important, because if there are 1,000 solutions, nothing will happen. No, it's not possible that only 2 solutions dominate the world, but the opposite also is not efficient. So for me, it's let's connect if possible, because if not, there is no impact possible from my point of view, of course.
Okay, I'm not so clear now what you personally will do, but I will move then to Tjasa and ask you, Tjasa, what are you going to do, and what has struck you? What new insight do you have? What do you want to take away from this conversation?
Well, I definitely look forward to connecting to all the speakers and continue the debate further, because I know that we only scratched the surface of what each of us is doing here. So I look forward to exploring opportunities there. Maybe just one thing that kind of got me thinking, and I would like to add, is that, when we think about all the innovation and democratization of healthcare, we also have to think about the importance of policy and politics in this story. We've seen with COVAX and with the dissemination of the COVID vaccine, the issues that happened because Europe wasn't prepared for the negotiations around the vaccine, how Bill Gates played an important role, and some say is playing a too important role in trying to get vaccines to all the people in the world. And when it comes to less developed countries, we might have innovations that work in the West, and more innovations today rely on cloud and Wi-Fi. But what do you do, in the middle of the desert when nothing of that is present there, and where the network provider has no interest in creating the infrastructure to support signal there? So politics and policy has an enormous role in really bringing healthcare to everyone in need. So not just those that can afford it can actually reach it. Thank you.
Thank you very much. Let's move on, and I have the same question now for Cristina. What is your take on this? One thing would you take away from this conversation?
It's the second time in this conversation I'm coming right after Tjasa, and I feel like I'm so much connected at a very deep level. She just basically summarized what UN, for instance, has to do in terms of policy. So thank you very much, Tjasa. You summarized it very well. So in addition to that, I would like to again thank you very much for this opportunity. I'm amazed always to see amazing initiatives like the ones presented by Jordi, Nadine, Alejandro. And I always said I've been for so many years in the European Youth Awards family, the way I call it, and I said, like, every time I leave such sessions very inspired, and I feel as a mother, as a person, that the future is really in the right hands, and with more initiatives like those, I think we will find the solutions. It's just a matter of time. So I'm still very, very hopeful, because as I said also earlier, only together and only together we can end this situation, and we can prepare us for future pandemics and future health crisis situations like this, and recover. This is also very important. How do you recover? Because we all know it went through different levels, not only to our health, but also in the economic and social aspects of our lives. So thank you very much for this opportunity. Thank you all.
Nadine, you have a sharp break at 15, so that's very good. So you will be short. Nadine, please.
I mean, I think the comments about, bringing government agencies, NGOs, others working together to enable is really critical. When we think about how we've been trying to approach this, it's been very much in that hand-in-hand partnership, whether it's with ministries of health, whether it's with telco providers, the future of connectivity. To probably answer also Tasha's point, I mean, we designed this to work on the lowest of bandwidth. We've done this in war zones, in camp hospitals, on naval ships, and in the field, and we've worked with militaries as well as established hospitals. So that is really critical in that design. But nonetheless, this success of this is about cohesive partnership and coming together, and that really has to be about awareness, people sitting around the table, multiple stakeholders. I mean, let's just be very clear. Healthcare is complex. There are multiple stakeholders, all revolving around ultimately the patient and the benefit to patients. And so we need to make sure that we're engaging those stakeholders and recognizing that complexity up front and putting in the effort and the work to make sure that we get everyone around the table to do that. And, again, I think my takeaway from today's panel is very much around that awareness, communication, engaging stakeholders, and making sure we democratize care for everyone.
Thank you very much, Nadine. And I know that you have to leave, but the last word is given to Alejandro, please. We can't hear you.
Sorry, on my side, I always leave very inspired after these sessions. I think one thing that is truly inspiring is to see how many solutions are being adopted everywhere in the world, really. And one thing that at least one of the key takeaways for me is how do we make solutions that are truly decentralized, and that means, again, relies on the power of sharing knowledge, sharing good information, and make technology so simple that it can be adopted anywhere in the world without in those places, especially in those places where you don't necessarily have all the capital, technology, and skill sets available.
So thank you very much, Alejandro. Thank you very much, Nadine. Thank you very much, Tjasa. Thank you very much, Cristina. And also thank you very much, Jordi. This is the end of our panel here on Hack the Healthcare Gap.